Hi, my name is Dr. Rick McKibben. I'm a physical therapist and clinical electrophysiologist. I do electromyography and nerve conduction studies throughout the state of Georgia. I've been in practice this is my 30th year, and have helped to train other electromyographers. I do a lot of teaching, a lot of continuing education, and I really love what I do. An EMG is a tool that you use to evaluate neuromuscular function. We put a small pin in muscles to estimate the function of a muscle. If there's damage to a nerve, then it'll affect the way that a muscle relaxes. It'll also affect the way that a muscle contracts. So we use an audible amplifier to listen to muscles and the evoked potentials that they emit to help to differentiate a normal muscle that's functioning normally versus one that has a problem with nerves going to it or damage to the muscle itself. A nerve conduction study complements an EMG where we physically test the response either from a nerve itself or a nerve that goes to a muscle, measure how strong and fast nerves are working. And again, EMG and nerve conduction testing complement one another to estimate neuromuscular function and neuromuscular disease. So really the purpose of doing an EMG and a nerve conduction study is to help to identify location. So we want to tell a patient where their problem is, we want to tell them how bad it is, and we want to evaluate enough other things to tell them what it's not. So when we're doing EMG and nerve testing, we're looking for nerve injury, so focal types of entrapments like carpal tunnel or cubital tunnel syndrome. And then we look for root level problems like radiculopathies, either in the neck or in the low back. And then look for diffuse neuromuscular disease like peripheral neuropathy or muscle degeneration like in the inflammatory myopathies and things like that. So that's the purpose of why you would do an EMG. If you had a patient that has weakness as a primary, then that's an indication for a referral, along with things like numbness and tingling or balance difficulties that you think might be associated with a problem in someone's nerve or muscle. Anytime you order a diagnostic test, the goal or purpose would be to change the plan of care. So you want to use, if you have a suspicion that a patient might have a particular condition, particularly like an entrapment syndrome or radiculopathy or a more diffuse process, the more you understand about what you're treating, then the easier it is to be able to direct care, because then you know what you're dealing with. You know how bad it is, and hopefully you know what it's not. So a physician would be able to utilize our information to potentially change medications, choose the appropriate therapies, and refer the patient to the appropriate provider if surgery is necessary to take care of the problem.